Welcome to the deep dive. Today, we're putting on our detective hats, you could say. We're looking into hyperparathyroidism in dogs and cats. It can be a pretty sneaky health issue affecting our pets.
Yeah, definitely sneaky. And our goal here, looking at the sources, is really to pull out the key info about it, make it clear, easy to understand, and focus on what's most important for you as a pet parent to know.
Right.
We'll cover the basics, causes, diagnosis, treatments, the whole picture for both dogs and cats.
And right off the bat, it's good to know there are two main types we're going to talk about. Primary and secondary hyperparathyroidism.
Exactly.
And the differences between them. Well, that's where it gets really interesting, I think. Okay, let's dive in. What exactly is hyperparathyroidism, fundamentally?
So, simply put, it's when you have a consistently high level of parathyroid hormone, PTH, in the bloodstream, too much PTH floating around.
Okay, PTH. What's its normal job, then, in keeping things balanced?
Right, so PTH, it's made by the parathyroid glands, these tiny glands in the neck. Its main job is regulating calcium levels.
How does it do that?
Well, it acts on a few places. It tells the bones to release calcium into the blood. It tells the kidneys to hold on to calcium, reabsorb it.
All right.
And it helps the intestines absorb calcium from food, but that part needs vitamin D to work properly.
Got it. So it's
Yeah.
like the body's calcium thermostat controller.
Sort of, yeah, a key regulator.
So if that PTH level stays high when it shouldn't,
Yeah.
what happens? That leads us to primary hyperparathyroidism, right?
Correct. Primary is usually caused by a growth, typically a benign one, an adenoma on one, or maybe more of the parathyroid glands.
A little tumor.
Yeah, a benign tumor usually. And it just starts pumping out PTH, ignoring whether the body actually needs more calcium or not.
Yeah.
The good news, though, is that these are overwhelmingly benign. Malignant ones are rare.
So often treatable with surgery.
Exactly. Surgery can often be curative.
Okay, that's definitely good news. Now, these growths,
Hmm.
why do they happen? Is it genetic? Can pets inherit this?
That's a good question. For the primary type, we don't have a specific gene pinned down yet, but we do see it more often in certain breeds, like Keeshondan in dogs or Siamese cats. That suggests there might be some kind of hereditary link, a predisposition in some cases.
Interesting. Okay. And how common is this primary form? Should people be really worried about it?
We see it diagnosed more often in dogs than in cats. It's a pretty common reason for finding high calcium levels, hypercalcemia, in pets.
Okay.
But it's worth keeping in perspective. Overall, high calcium is actually seen more often because of other things, like certain cancers, especially in dogs.
Right, like lymphoma you mentioned in the notes.
Exactly. That's a big one.
Okay, so which pets usually get primary hyperparathyroidism? Is there a typical age or profile?
Yeah, there is. The average age for cats is around 13 years old, typically between 8 and 15.
Older cats then.
Definitely middle-aged to senior. Dogs tend to be a bit younger, on average, maybe around 10 years, with a range usually between 5 and 15 years old.
And males, females.
Yeah,
Any
sure.
difference?
Doesn't seem to be. No real sex predilection that we know of.
Okay. And what signs might you see? If your pet has this, would you know? Would it be obvious?
Well, that's the tricky part. Often, especially early on, the signs are super subtle, or maybe even non-existent.
Really?
Yeah, most animals don't look obviously sick at first. The signs usually pop up because of the high calcium level itself, the hypercalcemia, and they get more noticeable when that calcium level is quite high and has been high for a while.
So what kind of signs are we talking about then when they do appear?
You might see things like drinking a lot more water and urinating more often. That's polyuria and polydipsia. Maybe decreased appetite, being lethargic or tired, vomiting, muscle weakness.
Okay.
In more severe or chronic cases, you can even see things like urinary stones forming, or even neurological signs like confusion or stupor.
Wow, okay. So quite a range, but nothing that screams parathyroid specifically.
Not really, no. A lot of those signs could be caused by many different things, and often the vet's physical exam doesn't show much either. Though, interestingly, in cats, sometimes the vet can actually feel a tiny lump in the neck where the parathyroid adenoma is, but that's much less common in dogs.
So if the signs are vague and the exam is often normal, how do vets actually figure out its primary hyperparathyroidism? What tests do they run?
It usually comes down to blood work. The classic pattern is high calcium in the blood serum combined with phosphorus levels that are low or maybe low normal.
Calcium up, phosphorus down.
Generally, yes. Kidney values like BUN and creatinine are usually normal. unless, of course, the high calcium has already started causing kidney damage.
Right.
But the real key is measuring the PTH level itself. There's a specific blood test, an intact PTH assay. Finding a high PTH level when the kidneys are working okay is a strong indicator.
Okay.
And here's a crucial point. Even if the PTH level is technically in the normal range on the lab report, if the animal has high calcium, a normal PTH is actually abnormal. It should be suppressed, low, if everything was working right.
Ah, because the high calcium should be telling the parathyroid glands to shut down PTH production.
Exactly. So if PTH isn't low, even if it's just mid-normal, that's suspicious when calcium is high.
Got it. What about things like X-rays or ultrasound? Do they help?
They can be very helpful, yeah. Imaging the neck and the abdomen helps rule out other causes of high calcium, like those cancers we mentioned.
Sure.
Sometimes an ultrasound of the neck can actually spot the parathyroid tumor itself, or show effects like kidney stones or changes in bone density. But sometimes the adenoma is too small to see.
So imaging isn't always definitive for finding the tumor itself.
Not always. And in some tricky cases, surgical exploration of the neck might actually be needed to find the abnormal gland and confirm the diagnosis.
And if they do find one during surgery, what do these adenomas look like?
They're usually pretty small, often less than a centimeter, kind of round, maybe light brown or reddish, and sitting right near the thyroid gland. Sometimes there might be more than one affected gland. And interestingly, even under the microscope, sometimes it can be tough for the pathologist to tell for sure if it's a benign adenoma, just an overgrowth of normal cells called hyperplasia, or even a rare carcinoma. So experience really counts there.
Okay, so diagnosis involves blood tests, maybe imaging, sometimes surgery. What's the usual treatment once it's confirmed?
Surgery is really the main treatment, the gold standard. The goal is just to remove the affected gland or glands.
Makes sense.
There's also a technique using ultrasound guidance to basically cook the tumor with percutaneous heat ablation. That can work well if the clinic has the equipment and expertise.
Less invasive.
Yes. Ethanol ablation, injecting alcohol, has been tried too, but seems generally less successful than surgery or heat ablation. But importantly, there's no specific medical treatment, no pill that fixes the underlying cause of primary hyperparathyroidism.
Right, you have to remove the source of the extra PTH.
Exactly.
Okay, that clarifies primary. Let's switch gears then to secondary hyperparathyroidism. You said this happens because of something else going wrong.
That's right. It's secondary to another problem that's messing up the body's calcium balance.
And the main culprits.
There are two main ones: kidney disease and diet. Renal secondary hyperparathyroidism happens because of kidney disease. This is super common, especially in cats with chronic kidney failure.
Why do bad kidneys cause this?
It's fascinating, really. Failing kidneys struggle to get rid of phosphorus, so phosphate levels in the blood go up. They also lose calcium in the urine, and critically, they become less efficient at converting vitamin D into its active form, palcitriol.
Ah, and calcitriol is needed for calcium absorption from food.
Precisely. So less calcitriol means less calcium absorbed. The body senses low calcium, or rather the imbalance caused by high phosphorus and dropping calcium, and tells the parathyroid glands, hey, make more PTH, trying to compensate.
So the parathyroid glands themselves are actually healthy. They're just responding to bad signals from the kidneys and the calcium phosphorus levels.
Exactly. That's the key difference. The glands are reacting appropriately, albeit excessively, to an underlying problem elsewhere.
Okay. And the other type? Nutritional.
Nutritional secondary hyperparathyroidism. This happens from feeding a diet that's too low in calcium or vitamin D, or has way too much phosphorus relative to calcium.
Like an all-meat diet or something.
That used to be a classic cause, yeah. Luckily, with better commercial pet foods and more owner awareness, we see this form much less often now.
That's good.
But it can still happen, and sometimes you see it linked with bone problems like fractures and just overall poor body condition.
Is there a genetic link for secondary hyperparathyroidism?
Well, not directly for the hyperparathyroidism itself, but if a pet inherits a type of kidney disease, that kidney disease can then lead to renal secondary hyperparathyroidism. So an indirect link sometimes.
Got it. And how common is secondary? You said nutritional is decreased.
Right, but the renal form is very, very common, again, especially in cats, because chronic kidney disease is so prevalent in older felines.
Okay. How does diagnosis differ for secondary? Are the blood tests different from the primary type?
Yes, there are usually some telltale differences. With the renal secondary type, we often see high phosphorus levels in the blood hyperphosphatemia. Remember, in primary, phosphorus is usually low or low normal.
Right. Opposite phosphorus finding.
Exactly. And another interesting thing, in chronic kidney failure, the ionized calcium level, which is the biologically active form, might actually be normal or even low sometimes despite the high PTH.
So high PTH, but normal or low calcium and high phosphorus points towards secondary renal.
That's a strong pattern suggesting it, yes, along with evidence of kidney disease itself.
And treatment for secondary. Sounds like you have to fix the underlying problem.
You absolutely do. That's the focus. For the nutritional type, it's about correcting the diet, getting the calcium and phosphorus balance right, often with supplements initially.
Makes sense.
For the renal form, it's much more about managing the kidney disease itself. Sometimes vets use calcitriol, that active vitamin D, very carefully to try and improve calcium absorption and suppress PTH without making calcium levels too high. But its use is a bit debated and needs careful monitoring.
Any other treatments for the renal type?
In humans, there are drugs called calcimimetics that trick the parathyroid gland into thinking calcium levels are higher than they are, reducing PTH. Their use in pets is still kind of experimental, not standard practice yet.
Okay, so I've got primary, caused by a tumor, and secondary, caused by kidney or diet issues.
Sure.
But you mentioned other things can cause high calcium too. We need to rule those out.
Absolutely critical. High calcium hypercalcemia can be a sign of several other serious conditions. It's what we call a differential diagnosis list.
What's on that list?
Well, in dogs, cancers like lymphoma and anal sac adenocarcinoma are fairly common causes. Other carcinomas, too.
Explain to cats.
Cats can get lymphoma causing it, but also things like squamous cell carcinoma, other blood cancers, even fibrosarcoma sometimes.
Huh.
Chronic kidney failure itself can occasionally cause high calcium, confusingly.
Oh, wow.
Then there's Addison's disease, hypoadrenocorticism, getting too much vitamin D, maybe from supplements or certain rat poisons, though that's less common now, certain fungal infections or inflammatory diseases. And in cats, there's also this thing called idiopathic hypercalcemia, where calcium is high and we just can't find the reason.
Idiopathic meaning we don't know the cause?
Pretty much, yeah.
Yeah.
So, yeah, lots to consider. Finding high calcium definitely warrants a thorough workup by the vet.
Definitely sounds like it.
Yeah.
So if a pet does have high calcium, regardless of the cause, how's that managed initially? Especially if it's severe.
Yeah, severe hypercalcemia can be dangerous, so lowering it is often the first step. The main tool is intravenous fluids, specifically normal saline solution. Giving lots of fluids helps dilute the calcium and encourages the kidneys to flush it out.
Okay, fluids first.
Then, diuretics like furosemide or Lasix can be used to further increase calcium excretion in the urine. But you have to make sure the pet stays well hydrated if you use those.
Right, don't want to dehydrate them.
Exactly. Corticosteroids like prednisone can also lower calcium, but vets are usually cautious about using them until they've ruled out cancer, especially lymphoma, because steroids can interfere with getting an accurate cancer diagnosis.
Good point. Avoid steroids until you know what you're dealing with.
Generally, yes, and obviously you avoid giving any fluids that contain calcium. For really severe or persistent cases, there's a drug called pamidronate, a bisphosphonate, that can be given intravenously and is quite effective at lowering calcium from various causes.
Okay. What about after the surgery for primary hyperparathyroidism? Any common issues to watch for during recovery?
Yes, definitely. After removing the overactive parathyroid glands, the remaining normal glands might have become lazy or suppressed because the tumor was doing all the work.
Ah, they were shut down.
Right. So after surgery, there's a risk of the opposite problem. Hypocalcemia, or low calcium levels. It's relatively common.
And can you predict which pets will get it?
It's tricky. Research suggests the pre-surgery calcium and PTH levels aren't actually great predictors. So basically, all patients need very close monitoring of their calcium levels after surgery.
And if the calcium does drop too low, how's that managed?
Treatment involves giving calcium supplements, usually by mouth, and also vitamin D, specifically calcitriol, the active form, to help the body absorb and use the calcium.
Needs careful adjustment, I imagine.
Very careful. Dosages are adjusted based on frequent blood tests, checking the ionized calcium level until things stabilize.
Okay. Finally, then, what about preventing this? And what's the overall outlook, the prognosis?
For primary hyperparathyroidism, unfortunately, there's no known way to prevent it from developing. But the good news is, if it's caught and treated with surgery to remove the adenoma, the prognosis is generally excellent. Long-term cure is common. There's a small chance of recurrence, maybe if another gland becomes abnormal later, but overall the outlook is very positive.
That's great. What about secondary?
Well, nutritional secondary hyperparathyroidism is absolutely preventable with a proper balanced diet. That's straightforward.
Good nutrition is key.
Always. For renal secondary hyperparathyroidism, prevention isn't really possible since it stems from kidney disease, but managing the kidney disease effectively can help manage the secondary hyperparathyroidism.
And what if hyperparathyroidism isn't treated?
Yeah.
Either type.
If left untreated, the persistently abnormal calcium levels, whether too high in primary or the complex imbalances in secondary, can cause progressive damage. It can lead to worsening kidney failure, urinary stones, and potentially severe neurological problems. So acting on it is really important for long-term health.
Okay, so summing it up then. Primary hyperparathyroidism, usually a benign tumor, fixable with surgery, excellent outlook.
Generally, yes.
Secondary hyperparathyroidism comes from something else, usually kidneys or diet. Treatment focuses on that underlying cause.
Exactly. Understanding that difference is really crucial.
And recognizing those signs, even if they seem mild, like just drinking a bit more and getting your pet checked out by the vet, is key.
Absolutely. Early diagnosis and appropriate treatment make a huge difference for our pet's well-being.
It really makes you think, doesn't it? Seeing the clear link between diet and one type and how subtle the primary form can be. It makes you wonder what other maybe seemingly small things in our pets' daily lives could have big long-term health impacts that we're maybe just starting to understand.
That's a really interesting question to ponder. There's always more to learn.
Definitely food for thought. Thanks for diving deep with us on this today.